Hi, my name's Mary. I'm one of the pancreatic dietitians here at the Royal Surrey County Hospital. We've put together this clip to talk to you about pancreatic enzyme replacement therapy. This information has been produced for people who have been prescribed pancreatic enzymes. The information within this is suitable for most people. However, there are a few exceptions, and if the information you've been provided with is different to the content of this video, please speak to your doctor, dietitian or nurse specialist. So we're going to cover what the pancreas is, what causes the pancreas to stop working, how pancreatic enzyme replacement therapy works, and how to get the dose right, and then cover everything else that you need to know about taking this type of medication. So first of all, what's the pancreas? The pancreas is an oblong gland. It's about 12.5 by 2.5 centimetres long, and it sits just underneath the stomach in the curve of the duodenum. It consists of endocrine cells that make insulin and other hormones such as glucagon. But its primary function is actually exocrine. It produces up to 1.5 litres of fluid a day that contains digestive enzymes to help you break down your food. These enzymes digest carbohydrates, fats and proteins. In order to understand how your pancreatic enzymes work, it's important to see how this works in context of digestion. Digestion starts as soon as food enters your mouth. That process of chewing breaks down large chunks of food into food particles that are small enough for you to swallow. But there's enzymes in the saliva as well, and that process also stimulates your stomach to produce stomach acid and your pancreatic enzymes to be produced from your pancreas. Once you swallow, food enters your stomach where the stomach acid breaks down the larger structures and the enzymes start to work. Once this partially broken down food leaves your stomach, it mixes with bile produced in your liver and the enzymes that have been excreted from your pancreas, and that's where the majority of digestion takes part, in this place of your small bowel. But the enzymes from your pancreas are not active when they leave the pancreas. They need hormones in your duodenum to switch them on. Bile from your liver and bicarbonate from your pancreas neutralise your stomach acid, and this activates the enzymes. These enzymes can now break down the food into tiny particles that your body can absorb. So, what causes the pancreas to stop working? The process of digestion is complicated, and there are many things that can make digestion less effective. For this video, we're focusing on the pancreas. Please ask your doctor, nurse specialist or dietitian for advice if you have different problems with digestion. So what happens when you don't digest your food properly? There are lots of different symptoms that can occur when your food is not digested. You may lose weight, you may experience diarrhea, which could be pale or oily in consistency and colour. You may notice your bowel motions are larger, more frequent, or have a more unpleasant smell than is normal for you. You may experience some urgency in passing these bowel motions. Some people find they experience bloating or excessive wind and belching, and others micronutrient deficiencies, particularly little vitamins and minerals that rely on normal digestion to be absorbed properly. So what is pancreatic exocrine insufficiency? This is the term used when the pancreas fails to produce enough enzymes for you to digest your food normally. It may still produce some enzymes, and the enzymes it produces, the volume of this may change with time. The pancreas cannot regenerate, so pancreatic exocrine insufficiency is usually permanent. However, in some cases of acute pancreatitis where the pancreas is very swollen, as the swelling settles, the pancreas may recover some of its function. There are many causes of pancreatic exocrine insufficiency. The most common include an operation to remove some of the pancreas, cancer of the pancreas, and acute or chronic pancreatitis. Other causes include cystic fibrosis, an injury to the pancreas, or a condition where the pancreas is not switched on, such as if you've had an operation to remove part or all of your stomach, or where the first part of your small bowel is not healthy, such as in untreated celiac disease. In these situations, the pancreas can be normal, but it's not working properly as it signals to turn it on and not working. There are other more rare conditions. Please speak to your doctor if you're not sure why you have pancreatic exocrine insufficiency. So what about pancreatic enzyme replacement therapy? This is the term given to medicines that provide enzymes in a capsule form to help you treat pancreatic exocrine insufficiency. We use the term enzymes when we talk about these products. There are 4 brands of enzymes available in the UK. They consist of Creon, Nutrizyme, Pancrease and Pancrex. Enzymes usually come in capsules, but there are other forms available if you're not able to swallow these capsules. So there are a few things that you need to know about enzymes. The most important being that they're made from the pancreas of pigs. Unfortunately, there's no alternative to this at the moment. Pigs are used because, like humans, they have a mixed diet. Other animals have more restricted diets and will not produce the same mixture of enzymes that we need. Plant and fruit-based enzymes, such as those derived from pineapple, papaya and rice, have not been proven to work when treating pancreatic exocrine insufficiency. Please speak to your doctor or dietitian if you have concerns regarding this. So how do we get the dose right? Everybody needs a different amount of enzymes, much like people who have diabetes will all need different doses of insulin. Most people start on a dose of around 50,000 units of enzyme with each meal and 25,000 units with any snack that you have. A healthy pancreas can make over 2 million units of enzymes a day, so whilst this dose sounds like a lot, in the scheme of what is normal for the pancreas, it's not. The dose is gradually increased until your symptoms have settled, and some people may need several tablets with each meal. There are a few other things you need to know about enzymes. They're sensitive to temperature and to acid, so make sure you store them below 25 degrees and swallow them with a cold drink. If the weather gets hot, keep them in the fridge. Make sure they're not kept near sources of heat, such as kettles, ovens, or in direct sunlight or on top of a radiator. If you think your enzymes have become too hot, they may not work, and you'll need to get a new supply from your doctor. Enzymes need to mix with all of your food. As you saw from the examples of how digestion work, the enzymes need to be in the right place at the right time. Therefore, you must take them every time you eat. Take half your dose at the beginning of your meal and the other half at the middle of your meal to make sure that they're distributed evenly. If you have a snack or a milky drink, you'll need to take your enzymes with this as well. We all eat differently. The bigger the meal we have, the more enzymes you'll need, and you'll often find that your lunch, dinner, snack, breakfast doses are different from each other as well. What if they don't work? The most important thing is to make sure you're taking them at the right time. They won't work if you don't take them at the same time that you eat. Make sure they're not too hot, double check where you keep them, and make sure you're swallowing them with a cold drink. Some people will need a medicine to reduce the amount of acid in their stomach, as the enzymes are also sensitive to acid. Talk to your doctor if you're not already on a medicine that does this. And finally, we need to make sure you're taking a high enough dose. Talk to your dietitian, doctor or nurse specialist. You may need a higher dose than you're currently prescribed. Do you need to change your diet? It's a really common question that comes out when patients start pancreatic enzymes. Most people are able to eat normally on these enzymes, but you do need to be aware of what's in your food. You're likely to need more enzymes if your meal is large. The meal has a lot of fat in it. Your dietitian may recommend a vitamin and mineral supplement to ensure you receive everything that you need. Some people are sensitive to certain foods, and your dietitian will advise you if this is the case. So in summary, pancreatic enzymes need to be taken with every meal and snack. Split the dose across your meal, and if they're not working, contact your dietitian, doctor or clinical nurse specialist. You might need a higher dose. Make sure you swallow them with a cold drink and store them below 25 degrees. We hope you find this information useful, and if you have any further questions, please contact your dietitian, nurse specialist or doctor. Thank you for listening.